Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa with PAR5 Physical Therapy, and I've partnered with them to bring you an easy and educational workday session. Today's session is how to protect your back when lifting. A little bit about me. I'm a doctor of physical therapy. I have a clinic here in Randolph, New Jersey. I specialize in orthopedics. I got my doctorate at Mercy College and my undergraduate degree at Rutgers University. I'm an orthopedic clinical specialist and a Titleist Performance Institute certified level 3 golf medical professional. So during today's session, if you have any questions, feel free to use our chat box to let me know. Just hit the chat button, and then we'll try and make this session as interactive as possible. So let's get this started. I'm going to take away this lower third here and bring up my slides. So how to protect your back when lifting. Now, I'm also going to include practical applications because right now in New Jersey, we just had a snowstorm. So we're going to talk about how to shovel and how to move things around as well. So this is going to be an active session today. Not a lot of slides, a lot of practical applications. So make sure that you're comfortable, you have enough space to move around. All right. Because I am a physical therapist, a medical professional, I have to give you this, this disclaimer that this is not physical therapy. This is just general advice. And this information is just for educational purposes to help you move better, feel better, and play better. So, but if you are dealing with something specific, a medical diagnosis or something, please get a physical evaluation or examination assessment from a licensed practitioner. All right. When we go through some of this stuff today, movements, exercises, postures, and positions, make sure that we don't push through pain. None of this should hurt. We want to hold stretches, gentle stretches with a prolonged amount of time, some static, about 30 seconds to hold the stretch, and make sure you work on your breathing. We don't want to hold our breath when we're getting in and out of positions or holding any positions, just to be gentle, cautious, and slow. All right. So the big rule and how the body works on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. And it looks like this. What we're mostly concerned about today is the lower back. The lower back is classified as a stable segment. This stable segment needs to be basically, there's a theory called the two-handed rule. If we take your sternum and your belly button, these two hands cannot become closer or wider apart. So this whole midsection needs to be stable. The hips and the pelvis below that needs to be mobile, and the thoracic spine, the segment above that, needs to be mobile as well. So this alternating pattern is key if we want to have a healthy and fit body as we age. So the concept of midline stability over distal mobility, that just means that we need to have our chassis of our body stable if we're trying to move and move stuff around. So for example, my arms, my legs, my hips, those are the extremities, and we want those extremities to be mobile. I want to be able to have my full control of my body and my limbs, but we can't generate force or push or pull stuff if our chassis, our midline, isn't stable. So that two-handed rule is going to be applied with a lot of these things that we're going to be talking about later. All right, so these are the things we're going to be talking about. The midline stability, what does that look like? What does that mean? Some hip hinge progression, basically how to use our hips properly to protect our back and use the bigger muscles of our glutes and our hips to lift and push and pull things. And then we're going to go into some practical applications. So I'm going to get rid of this slide, and we're going to go into our dual camera setup here. Awesome. And the first thing that we're going to talk about is midline stability. Midline stability, we talked about this two-handed rule. You know, if I'm standing here and I'm in a neutral spinal position, I want to be able to say that I have a neutral spine. My pelvis, our pelvis is basically a basin, right? It's like a cylinder. We don't want to have that cylinder tilted forward or tilted backwards. So we want to make sure that our pelvis is neutral, and we do that in this standing position by squeezing the glutes, the butt muscle, right? So if I put my feet shoulder width apart and make sure that my feet are totally pointed straight, I'm going to squeeze my glutes. And if I squeeze my glutes, what you should feel is a little bit of a tilt that happens with the pelvis. And that tilt puts your glutes or puts your pelvis in a neutral position. Once we have that, we want to have our torso, our thoracic spine in a neutral position. Because I don't want to have this in that position and then have my body be in an overextended position. So I'm going to turn on my abdominals and bring my rib cage barrel, that's another basin, a cylinder, stacked over the pelvic basin as well. So we're going to have those two things connected and join them together by the abdominals, the core. So I'm going to get onto the ground. Let me just tilt this down so you can see this angle as well. So we talked about midline stability, and then what's our main muscle that we're going to be talking about? We're going to be talking about the transverse abdominis. The transverse abdominis, for people who have chronic back pain, have a real, these are types of people that have a real hard time in connecting this muscle to the brain. So we have 4 different abdominal layers, abdominal muscle layers. We have the rectus abdominis, which goes up and down. When we have the 2 layers of the internal and external obliques, they're the diagonal ones. And the deepest layer is the transverse abdominis. It wraps around like a girdle. If you've seen people wear back braces or a girdle, it's basically runs that same pattern. If it creates tension, it creates rigidity through our midline, through our trunk. So the only spot that we can palpate or feel this muscle working is right off the pelvic bone. You're going to feel your pointy part of your pelvic bone right here. It should be easy to find. And then we're going to put the fingers about 2 inches inward towards the belly button. And if you're relaxed, all of this should be soft. When we contract or say, pull the belly button into your spine, you should feel that muscle get taut. It should get tense and firm underneath your fingertips, and you should be able to breathe normally. A lot of times people have a hard time contracting this muscle, and all they do is they just hold their breath. They suck in their diaphragm, and you cannot function if you cannot breathe. So that is our first step in creating this midline stability, all right? Activating the transverse abdominis in this position is the easiest position to do it in so that we can manipulate stuff. So you could also do this in a seated position or a standing position, but lying down is the easiest position to get in touch with that transverse abdominis muscle, all right? And then I'll go into the hip hinging. So the hip hinging, pull this up here. I'm going to get my PVC pipe here. So I've got this stick, a broom handle, a golf club, anything like that can work. What we're going to look at here is creating this straight line. So I have this straight line. My head, my mid-back, and my hips are touching the stick. I have my right hand on the small of my back there. There's a natural lumbar curve that's there, so I've got space to put that in. Now, I want to be able to bend and pick something up without losing this alignment here of the 3 points, my pelvis, my mid-back, and my head. So from here, I'm going to bend at the hip, okay? So I see from the side view here, I'm going to get really aligned. I'm going to bend at the hip, and I haven't lost contact of those 3 points, all right? So again, we talked about that midline stability. When you're bending to lift something up, we don't want to have a flex posture where I've lost contact with my head, or an excessive extended position where I lose contact with my mid-back. I want to make sure that everything stays neutral, engaged with the abdominals, that transverse abdominis, and I could hip hinge to come down. So you could probably see that I'm bending a lot at my hip and a knee, but more at my hip and less at my knee. A lot of times people will go down into a position where they're going to go lift something up, and they immediately do this. They think that they keep the back straight, but I'm up on my toes, my heels are elevated. This is not a stable position to be in. I can't really manipulate or lift stuff here. When we say keep your back straight and lift with your legs, that doesn't necessarily mean keeping your back vertical, right? So keeping my back vertical and trying to squat like this, which is I see a lot of people try and do, and they lose balance. we want to make sure that the feet stay flat and my back remains straight. This is straight, it's just not vertical. So that movement right there happens at the hip. You should feel that, this hip crease right here, the pocket area of your pants, we're creasing that in. Think about like if I put a pencil right there, I'm gonna squeeze that pencil with my body. So this is the position for us to lift and move stuff in. All right, so we have that midline stability, and then we're hinging at the hip. Remember that two-handed rule that we talked about? The belly button or your pubic bone and your sternum, those two things should not come together or come apart. So that can also be your cue that if you start to bend and we get short there, that's bending more on your lower back, or we get hyperextended, that's too much. So again, this two-handed rule should not change as we move. So this is a proper way to lift and carry stuff. Now, if I have something on the ground and I'm going to lift that up, we've got a couple different methods to do that. So this maneuver, this hip hinge, kind of gets into what we call like a deadlift type of exercise, where I'm lifting something from a standstill off the floor, right? Using my hips and my legs to do that. And the key thing, the key cue that I have people do is think about keeping your feet flat and don't let your knees come forward. Don't let your knees come forward. All right, so that'll keep the weight through the midfoot or maybe even towards the heel and engage the hips more than the knees. A lot of times if we use the quads, the knees a lot more than our hips, then we wind up with knee pain. Okay, so let's just say we learn how to pick something up. And another way is doing the a single-legged or a half-kneeling one, a half-kneeling way to pick stuff up. If we can't get into this, deadlifting position, we can go down to one knee and then bring this up close to our body. A weight, when it's closer to our center of gravity, creates less stress on the back versus a weight that is farther away from the body. So we keep that close, and then we could stand up from that position using one leg, but the mechanics are the same as this. As you can see, the shape that leg is making, my right leg that I'm pushing off of, is the same shape as if I did this with both legs. All right, so if we apply this to the shoveling or doing something with a stick or an implement, sweeping, I've had a couple of clients ask about how do I protect my back when I vacuum. You basically want to be able to kind of go forward and backward and use the feet to let me get a shorter one of these. Use the feet to turn your body as a unit versus twisting. The lower back does not like to rotate. So if we flex and rotate or extend and rotate, that's what causes issues with the lower back. The lower back is designed for flexion and extension, like bending and straightening, and then side bending. It does that, that's fine. Side bending, flexing, extending, going forward and backward, but it doesn't like to rotate. Rotation should happen at the hips and the thoracic spine. So one technique that I have people do with shoveling is that you want to keep this shovel, the load, in front of you, and you're going to stagger your stance, one foot in front of the other, and we're going to go in there and load that shovel up. And then when we lift this, we want to keep your hands or that weight, again, closer to your body. So if I'm here and I'm trying to shovel this up, the weight's all the way at the end. This is relatively heavier, or I need more effort to lift this, versus if I separate my hands, bend down, and I'm lifting like that. So now that weight is closer to my body. It's more closer to my center of gravity, and that's less force. And then from here, I could take a step and then push that out or shovel. Another one that I love to do, especially on last year when we had about 3 feet of snow here, to get those heavy layers of snow off, I did a movement that was a little bit more explosive, a little bit more quicker, a little bit more advanced, but you could try this out the next time that you need to shovel. We're going to do the same thing. We're going to load that shovel up with our snow, and then I'm going to straddle the broom handle or the shovel handle so it's straight in front of my line. And I'm going to grab this with both hands, similar to how I would use a barbell, and then the snow's over here, and I'm going to take the snow and then shovel it backwards. So I'm basically coming from this position and then standing up and pulling. I'm going to show you from the side view. I'm going to come in. I can come in any way, sideways or forward. But when I go to lift this weight, I'm going to get sideways here, grab a hold of this, a good width with the hand, and then forcibly drive my hips up, meanwhile pulling the hand back. So that motion is all hip, and then pull, and then the snow goes behind me. And I love doing that because then you can get your exercise in. I've got a chat message here. Let's see what that says. Could you also show best way to tie laces on boots with or without a chair? Excellent question. How to tie laces on boots. You know, I have my boots here. I'm going to slip these on. So I'm going to put my stick down. So with or without a chair, if we have laces on boots, and this, you know, we're going out into the snow, the big thing is what is the limiting factor getting you to touch your feet? If you have a hard time touching your feet with or without a shoe, then we're going to have problems trying to manipulate that. So think about it this way. Is it the shoe that's the problem, or is it our range of motion in the hip or the knee or the trunk for me to get down into this position? So there's a couple options, you know. If I have my shoe here and I want to tie that, I could sit down, I could lean forward and get there. If this is tight, then we can go with the cross-legged version. And then if this is tight, then we look at, okay, why can't I do this? And we have to think, all right, it's probably a hip issue. Can I have full mobility and express the range of motion that's physiologically normal in my hip before I think about how am I going to tie this shoe, right? So a couple options. I mean, if you have enough hamstring flexibility, you can do it in standing and then just bend over and manipulate the shoe that way.